Arkansas's breaking news leader. Fox 16 News at 9 starts now.
In tonight's Living Well report, a woman's quality of life literally deteriorated right before her eyes.
Yeah, the pain in her hips prevented her from doing the one thing she loves doing the most, and that's riding horses.
So Fox 16's Suzanne Bruner shows us how hip replacement surgery helped her life, and now she's living it to the fullest.
That's our relaxation, is to just get on the horses and go ride, or load up and go to the barrel race on the weekend.
5 days a week, you'll find Dixie Lee West riding her horse. It wasn't until 2005 the pain in her hips would make the rides difficult.
When the hips started to freeze, I couldn't sit in the middle of a horse. It affected my riding. It affected everything.
The 44-year-old says she had a heart infection that caused the cartilage to deteriorate in her hip. For the pain to fully go away, doctors recommended Dixie Lee undergo hip replacement surgery.
It's a major deal, and I didn't know if I wanted to do it or not. I was scared.
Scared about surgery and how young she was to follow through with a procedure like this.
And I had to put a lot of thought into it. And, was this a risk I was willing to take? Hi, I'm here to see Dr. Hudson.
The risk was well worth it.
I have not regretted it for 1 minute. Not for 1 minute. I feel absolutely amazing.
You can imagine how amazing the moment was for Dixie Lee when she got back on her horse.
I had to do something, or I was going to go crazy. I couldn't do what I loved. I couldn't be the kind of mom I wanted to be.
She's got complete joint space loss.
Baptist Health orthopedic surgeon Stephen Hudson says it's more common to see younger adults get a hip replacement.
Other people, if they've had an injury to that joint at a younger age, can get arthritis at an earlier age. And we are seeing that a lot more commonly, especially with the population being more active. You can see the difference between the left hip and the right hip.
Dr. Hudson says obesity also plays a factor as the weight causes stress to hip joints.
Hey, how are you?
Good. How are you doing?
Doing great.
Good.
Tired of the pain and unhappiness, Dixie Lee looked past her age and opted for a hip replacement.
You're not guaranteed tomorrow. Fix it today, live today, and be happy today. I wish I would have done it a few years sooner.
Dixie goes up to 16.
Well, at least she did it now and she's happy.
Yes, she is.
Yeah, you can really tell.